Landmark, I start at the thyroid, find the cricothyroid membrane, thyroid cartilage. Then I'm using my index and thumb to kind of secure the trachea. My index finger is right next to the cricothyroid membrane. But remember, this space is going to be really, really narrow. So aim 45-degree angle caudally towards the feet. So I'm going to kind of find where my membrane is, and I'm aiming. And then as I'm going in, I'm trying to aspirate. And once I get aspirate back, now I know I'm in the trachea once I get air back. Once I know I'm there, what's going to be key is not to let my needle advance. All I want to advance is my catheter. So I'm going to secure this and advance my catheter this way. But you see how much of my needle is still sticking out? And then I can remove it. If I didn't have this set up, I could take a 3.0 ET tube, pull it off. I could attach it directly. Tony made this with a 3.5 and some extension tubing. So I just screw it on again. I'm going to go ahead and attach entitled CO2, and I'm going to attempt to ventilate. Recognizing I'm creating a lot of pressure, I need to do something. And I'm going to demonstrate that for you now. I'm going to turn off the pop-off valve so that I can generate enough pressure to give a breath. And it is going to be like this. This is what it's going to feel like. And so at this point, I'm able to oxygenate the patient for about 20 to 40 minutes is what the books say, but I'm not ventilating because there's no way for CO2 to escape.
So is it going to be difficult to vac like that
Yes.
just because it's so small?
Yes. So the length of the catheter creates resistance. The length is exponential resistance. So 10 times. So the longer the catheter, exponentially, it creates more resistance. So you want to use a shorter catheter if at all possible, and a bigger catheter. But try to give a breath without turning off the pop-off valve. Try to give a breath. You see how it's coming off? Mm-hmm. Yep. See that, Gabby? It's coming off here. And how you're going to know that is there's not going to be any chest rise.
Right.
And a lot of times you're getting out of the way because you're trying to do it and it keeps hitting you in the face. Close it off. There you go. And now this allows you to force it in there. And it's going to be like that. Okay?